The definition of infertility is the inability to conceive a child after a year of unprotected intercourse or the inability to carry a fetus to term. About 10% of women ages 15 through 44 in the United States have difficulty getting or staying pregnant. Some major causes of infertility are hormones, stress, and immunological factors. In females, infertility is often due to problems with ovulation, low or high amount of body fat, and age. In males, infertility is often caused by varicose vein, low sperm count, decreased sperm motility, and poor sperm morphology.
With the technique of intrauterine insemination, sperm is provided either by the male partner or by a third-party donor whose sperm has been stored in a deep-freeze sperm bank. Before insemination, the sperm samples are prepared in the laboratory. They are assessed for safety, quality, and quantity and then passed through a filtering system for grading and washing. With a syringe and fine tube, the prepared sperm cells are then introduced directly into the cavity of the uterus, beyond the mouth of the womb and the cervix. They immediately make their own way towards the uterine tube. The objective of IUI is to bring these sperm cells as near as possible to the egg.
All fertility treatments in which both eggs and sperm are handled are known as assisted reproductive technology, or ART. In general, ART procedures involve surgically removing eggs from a woman's ovaries, combining them with sperm in the laboratory and returning them to the woman's body or donating them to another woman. Gamete intrafallopian transfer involves the use of fiber optic instrument to guide the transfer of unfertilized eggs and sperm gametes into the woman's fallopian tubes through small incisions in her abdomen. Zygote intrafallopian transfer is when a woman's eggs are fertilized in the laboratory and then transferred to her fallopian tube.
A further development of IVF is the technique of intracytoplasmic sperm injection, or ICSI for short. This is a method which has revolutionized the treatment of male infertility in recent years and gives men with poor quality sperm the chance of fathering their own children. In natural conception, many millions of sperm cells in each ejaculation are necessary for fertilization. In ICSI, just one may be enough. Women having ICSI are given special reproductive hormones to encourage several eggs to develop in the ovaries. The eggs are then removed from the ovary in a short outpatient procedure. Fertilization in ICSI is achieved by injecting an individual sperm cell into each of the collected eggs. For this purpose, each egg is placed under a very powerful microscope and a single sperm cell is injected directly into it by means of a very fine needle. Following injection, and after about 24 hours in the incubator, most of the eggs will show signs of fertilization, and the cells divide and multiply to form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin flexible needle, where it is left to implant and form a pregnancy.
A frozen embryo transfer is a cycle in which the frozen embryos from a previous IVF cycle are thawed and then transferred back into a woman's uterus. In vitro fertilization involves extracting a woman's eggs, fertilizing the eggs in the laboratory, and then transferring the resulting embryos in the woman's uterus through the cervix.